A family practice in Maine, where a doctor rides to house calls on a scooter. A healthcare system in Alaska, owned and run by Native Alaskan people. An alternative to nursing home care in San Francisco. An innovative medical school on Long Island. Their mandate? To promote health, prevent sickness, to help people live long, productive lives. All across America, it is a time of possibility and hope. My father was a doctor, a general practitioner. He commanded few miracle cures, but he forged profound connections with his patients that, in my mind, made him a hero in the high drama that is medicine. As I watched today's doctors at work, I was in for a surprise. I saw the same intense commitment to connect with patients, but it was the patients who claimed center stage.
You know, the many years that I was in practice, it was really a doctor-centered practice in the sense that everything was organized around making me efficient, not necessarily making the patient most satisfied with their encounter with me.
Seaport Community Health Center, this is Jamie. How may I help you?
David Loxterkamp has been practicing family medicine in the same small community for 20 years.
We've been trained exquisitely well in medical school to fix what can be fixed, but it's a small part of what we do every day. Most of what I do has to do with bringing down a person's weight, bringing down a person's blood pressure, helping them learn to become more mobile. You know, 90% of what I see in the office now, it relates to chronic conditions, not acute emergencies. How has your diet been in terms of the diabetes? Tell me about that.
David's father was the only doctor in a small town in Iowa, where David grew up. Like his father, David wanted to practice alone, but he changed his mind. Today, he works as part of a team.
Do you see that? Doing what my father did for the first 20 years of my practice, I realized that medicine is too difficult to do alone. This is a really hard, emotionally draining job. You really need someone else to help you out.
We want our practice to revolve around the patient's needs, David told me, not our own. If you're hurting, you can get an appointment within hours with just a phone call. And if it's urgent, call the office before visiting the emergency room. Someone from the team is on call 24 hours a day, 7 days a week.
Take some deep breaths in and out. Healthcare needs to be a collaboration. The patient's trying to get better, we're trying to help them, and when the patient and I have succeeded, it's a real satisfying feeling when they leave the room.
The Native Alaska people have designed an entire healthcare system to nurture the relationship between patient and doctor. I traveled to Alaska to learn how the South Central Foundation cares for 65,000 patients across 100,000 square miles. The Indian Health Service tried and failed. Not so long ago, the Indian Health Service in Anchorage was delivering medical care through a hospital emergency room.
Very rude, no relationship, not personal. Literally, when people went to the hospital, they assumed that they were going to go there to die.
In 1998, the Alaska Native people took over the failing system themselves, built a primary care facility, and made it the focus of their practice. Today, medical care in South Central revolves around many teams. Doctors are surrounded by medical assistants, pharmacists, behavioral psychologists, dietitians, and midwives, sharing information in real time. And there is no place in Alaska beyond the reach of the medical team. Even in far-flung villages where there are no doctors, South Central works closely with community health aides.
Most of the villages are only accessible by plane, so I am the eyes, hands, ears, nose for the doctor who you're reporting to.
We are, from the depths of our heart, trying to be healthy people. And it's not an easy journey. We've had a rough life and history. And the rising up right now is right here. It's right here, the brightness of what's happening.
The medical care at South Central is built around a shared history and a sensitivity to the values of the community.
We're owners of our own healthcare. It's up to us to change how we live, how we eat, exercise. We're not passive. We are now in relationship with our doctor.
In the next 20 years, 72 million Americans will be over 65, twice today's number. What's going to happen when so many elderly people can no longer live on their own, when they need nursing home care?
I just can't see myself in a nursing home. I think that there's a lot of lonely people. I don't think I could handle that situation.
Most of us live at home. The real question is, why can't you stay at home? What we are able to do is provide an alternative during the day for the person, you might call it daycare, and bring a variety of resources into the home that allows them to stay at home.
Twice a day per week, home care come and help me do some like a vacuum or do the laundry or shopping for me.
We take care of diabetes, we take care of kidney failure, we take care of very fragile, weak, elderly people. Now, it involves a risk, but we partner with people who want to stay at home so much that they're willing to accept that risk.
Good morning. Hey, good morning.
But it can be lonely staying at home all day. That's why participants travel to a place where they can enjoy the companionship of other seniors. And the doctors? I wasn't surprised to find the doctors working with a team of other healthcare providers, meeting every day.
We're really helping people stay away from medicine. I look at my medical staff as a tool to help keep people out of nursing homes. I never am able to say to somebody, "You're young again." That would be great. But I feel a privilege taking care of people who've made it to their 90s and 100s and help them in their final years live with dignity and hopefully stay at home. I think that's the greatest job. I love it.
How will we prepare the doctors of the future? Edem Seyum has just begun the arduous 4 years that will turn him into a doctor. In his very first week at the Hofstra School of Medicine, he was certified as an EMT and sent out on the firing line. Hofstra takes the traditional approach to the medical curriculum and stands it on its head.
The very first place our students ever encounter patients in medical school is in the patient's own homes and in the patient's own communities, not in the doctor space.
It's hard to imagine one day you're like an undergrad and next thing you know you're here in medical school. Because you kind of think about it, you prepare yourself for the moment, and then you're finally there.
We want them to become doctors and truly become new people, but that those new people should be always seeing patients as people in need of healing, not people who are just diseases presenting to their office.
So as we go along, I might just write a few things down just to make sure I don't miss anything.
Okay.
Bedside manner has always been a powerful weapon in the doctor's medical arsenal.
So I wanted to have it checked out.
Hofstra believes they can teach bedside manner through role-playing, putting the student in an examining room with an actor playing a patient, and then critiquing the student performance.
Your smile made me instantly feel like I could trust you.
To be effective, you have to be able to establish trust in very, very short periods of time. In emergencies, sometimes in matters of minutes, you have to get people to trust you with their life. That's a real skill.
And traditional subjects like anatomy and physiology, they begin and end with the patient.
You embed the science in real patient cases, and you test concepts. and not endless strings of individual facts.
When my father went to medical school, it was pure memorization, straight up.
Yes.
Was it still that when you were going to school?
It certainly was. I used to tell my wife when I would come home that there was no difference between what I was doing in medical school and memorizing the New York phone book.
Doctors need to be prepared for disaster and to depend on a team larger than themselves.
What are we gonna do here? We didn't get a BP. There's so many people here and nobody got a BP.
To learn how to work as a team, Hofstra students train with New York City firemen to handle simulated disasters.
It's really about the team working well. Rarely is it just one person, being the solo perfect fighter pilot.
Can you tell me a little bit more about yourself as well, just to get like a typical day in your life, just to get a better feel?
So you're going to train your students with these kinds of values and this kind of critical thinking. Then they're going to go off into the world of a broken medical system.
Physicians cannot be bystanders. They have to engage. They need to really take a strong lead in getting the healthcare system to change.
They're going to go into a healthcare system that costs too much, isn't organized well enough to deliver smooth, continuous, organized care for patients, but at the same time can do more to change the course of human disease than ever before in history. So, on one hand it's broken, or maybe discombobulated is a better way to put it, but on the other hand, they're going to go out with tools to make people healthy like no physicians in history ever had. There's no reason to beat ourselves up. We've done unbelievably well in advancing the care of patients. Now we have to figure out how to do it right.